I did not want a traditional surgery because I knew it would make me feel better, but within 5 to 7 years, my disc is going to collapse. It may slide forward, and if it slides forward and collapse and things thicken, then I need a foraminotomy. The exiting nerve comes in, which in a traditional sense, 9 times out of 10 requires a fusion. And when you have a fusion, the levels above and below begin to degenerate because there's no motion at the one segment. Ergonomically, it puts more stress on the segments above and below. So you wind up chasing your tail, and within 5 years, you develop stenosis above or below, or the disc degenerate, you wind up with horrible back pain. You can't fix back pain with surgery, so the goal is to avoid surgery. Less invasive to more invasive. So my trip out here to see Dr. Kamson was to have a less invasive surgical decompression of my spine that would allow me to get up the same day, walk, with a Band-Aid on my back. The approach Dr. Kamson was able to utilize to decompress my spine didn't destabilize my spine. And if I had a traditional open surgical approach from the neurosurgeons and orthopedic surgeons, and they do terrific work, the ramifications are inevitable. You remove the structures from behind that support the spine, there's more motion. And when there's more motion over time, there's more hypertrophy of the posterior elements, the facet joints, the ligamentum flavum. We don't even see the foraminal ligaments that are in the foramen, which plays a huge role in continued nerve pain after traditional surgery. The difficulty is finding good surgeons or good physicians to take care of us. So if you're looking for someone to do it, you have to seek somebody out. And some of the best people who can do this stuff are not in America. They're in China, they're in Korea, they're in France, they're in England, they're in Germany. Dr. Kamson is one of the few physicians that I know in the United States that can do what needs to be done less invasively, cares about his patients, taking the time to travel the world to educate himself. So I had my surgery yesterday by Dr. Kamson. He reviewed my films, thorough enough to take some more films to make sure nothing changed before the surgery, which was nice. And then he did my surgery. I was awake during the surgery. I was talking to the surgery. I'm sure he appreciated it. But I left last night with a Band-Aid on my back. My back's a little bit sore because I had a little cannula in my back. You have a cannula in your knee for surgery. Slept well. I'm up and walking the same day. I feel great. Back's just a little bit sore, like someone punched me. No big deal in the grand scheme of things. And when you're a physician and your goal is to take care of your patients and you put your patients first, you take the beating along the way because your goal is ultimately to take care of your patients the best way you can. And for me personally, I live it. You have no quality of life if you're in pain 24 hours a day. And to enjoy your life, you got to be able to feel good, you got to be able to function. And so at the end of the day, you want to maintain the integrity of your body, do as little as you have to fix the problem. And we're getting into some tremendous, the future is tremendously promising in regenerative medicine. And Dr. Kamson's on the cutting edge of regenerative medicine, and that's another reason why I'm here. After he decompressed my spine in a few hours with an endoscope awake, he applied some of the latest stem cell therapy to help regenerate my disc, maintain the integrity of the joint space, and perhaps grow a little more cartilage and help the joint pain as well.